welcome you dearly to have our webinar open to the public about diagnosis, treatment, and technique, things to do and to avoid in artistic voice professionals. These are very good presentations from my colleagues and from the COMET members that we offer to the public. And as you know, when you allow those, we are going to upload in our YouTube channel also. So first of all, we are going to have our dear COMET member from Argentina, Soledad Sacchieri. She's going to talk about breathing and the effects of unsupported singing. Sorry. And then we are going to have the maintenance of singing with our dear Shigeru Hirano from Japan. Then I will talk to you about food and treatment for reflux in artistic voice. And then we have Deborah. And Deborah from Greece. She's going to talk about body wellness in singing. And our dear Orietta Calcinoni from Italy. You please close your microphone. We shall begin our presentation. So please close your microphone. We are going to read a very short So Soledad Sacchieri from Argentina, she has a PhD degree in speech therapy. She's also a teacher and a great singer in operatic and popular singing. She is also full professor of different topics like vocal training for actors, vocal pathology and therapy, and euphonia, among many others, in several universities in Buenos Aires and some other parts of Argentina. She is also teacher of the doctorate in speech therapy at the University of the Argentine Social Museum seminar, and she has been giving lectures about updating vocal production techniques. She has also published several very interesting books about these wonderful topics. She has been speaker at numerous courses, workshops, seminars, and conferences in the field of professional voice. She has also artistic training, as I told you before, in singing and repertoire abroad. She was very close to Renata Tebaldi in Milan and to Peter Elkus in Manhattan, and of course in her Buenos Aires, also with our dear Susana Nairish. So let's enjoy the video that Soledad has prepared for us. Thank you, Soledad. Buenos días. Liza, hello.
Good afternoon, everyone. It is an honor to address a topic that continues to challenge our understanding on vocal pedagogy, air management in professional singing. Despite the extensive research, voice science has not reached a consensus in which is the most suitable breathing technique for apposio, for singing. These discrepancies and disagreement manifest in the diversity of opinions regarding in which are the group of muscles involved in apposio or breathing regulation. The discrepancies have multiple origins. Richard Miller suggests an influence linked to geographical origin, while McCoy observed gender differences. Men tend to concentrate their muscular activity in the lower part of the thorax and epigastrium and in buttocks, while women also find pelvic floor important. These differences seem to stem linked to anatomical variation rather than fundamentally different techniques. The main debate among singing schools focus in breathing behavior, abdominal alignment strategies during apposure. While teachers disapprove of clavicular breathing, they share a belief on pursuing the delay of diaphragmatic accent during expiration. Diaphragmatic control divides into two main techniques. The belly out technique, where the abdomen relaxes to maintain the diaphragmatic muscle contracted, and the belly in contrast, where the abdomen is relaxed, with two variants: the co-activated diaphragm, where both abdominal and diaphragm muscles are contracted together, and flaccid diaphragm, where the diaphragm relaxes all over the singing, leaving the singer with a completely lack of apposure. As we mentioned, different schools around the world have different approaches. The German school adapts a belly out technique with a relaxed abdomen and contracted diaphragm, but promotes unnecessary tension through contracted buttocks and sphincter closure, and also has a gorilla posture with a depressed chest and inclined shoulders that is not a benefit for the apposure. On the other hand, we have English school that prefers a clavicular tap with elevated chest and shoulders, a contracted abdomen, and upper back area expansion, and this promotes an extension with high laryngeal position that is not advisable for singing. French school considers breathing behavior an instinctive and automatic act, so they prefer a natural and instinctive breathing. This superficial breathing promotes clavicle engagement, flaccid diaphragm, and ribs that retract rapidly. On the other hand, we have that current scientific evidence reveals that Italian school has a superior approach with a coordinated abdominal, diaphragmatic, and intercostal action that promotes a good support or apposure. They prefer co-activated diaphragm with postural alignment and stable sternum, posterior and anterior expansion. As we have mentioned, belly out and co-activated diaphragms are the only strategies that promote the contraction of the diaphragm, and this brings a benefit, a physiological benefit, that is tracheal traction. Tracheal traction, promotes when the diaphragm contracts, it pulls from the trachea and the larynx, promoting laryngeal descent, reducing glottic compression, decreasing the cricothyroid overaction and preventing hyperfunctional phonation and avoiding hard glottic onset. As we mentioned, flaccid diaphragmatic strategy have many problems. Not only the diaphragm relaxation, but also lacks proper apposure. The loss of tracheal traction benefits. These consequences for the singers condemn them to a compensatory tension with vocal limitations that with a proper breath support they wouldn't have. Thank you for your invitation.
Thank you very much, and I am sorry for the technical problems. And I would like to thank Soledad, because this is not a very easy topic, but anyway, we shall discuss after our presentations. Now I may read a short curriculum from our dear COMET member, Professor Shigeru Hirano. He's Doctor of Medicine. He's working at the moment as professor at the Department of Otolaryngology, Head and Neck Surgery in Kyoto Prefectural University of Medicine. Wonderful city. His major research interests lie in investigations of otology, rhinology, laryngology, and head and neck cancer. He based mainly in his research and fellowship training. He has received several awards and honors, and he has authored several research articles. And we are very happy to hear this presentation, very interesting, maintenance of singing voice. Thank you.
Hi, everybody. I'm Shigeru Hirano, Kyoto Prefectural University of Medicine in Japan. Today, I'd like to talk about maintenance of singing voice. Voice is produced by respiratory power, vibration of the vocal folds, and resonance in vocal tract. And the vocal is the center of creating sounds of the voice. This is kind of string of mucosa. It vibrates at a high-speed format, like 100 Hertz up to 800 Hertz. And this rapid vibration is supported by the sophisticated histological structure of the vocal mucosa, which includes layered structure and Henrich acid distribution. Vocal fold is damaged relatively easily by the vocal abuse in cases of singers or other professional voice users, inflammation, smoke, aging, surgery. Today's talk is made on the vocal abuse and aging effects of the damage of the vocal. The worst scenario of the damage of the vocal is the scarring of the vocal. It causes irreversible disruption of the mucosa, leading to severe permanent dysphonia. Very low vibration or no vibration at all. This is too bad. Histopathology of vocal fold scar shows no layered structure at all, and then the whole of the propria is occupied by the thick fibrosis. There are only two fates of wound healing: regeneration or scar. And scarring is a rapid protective mechanism of wound healing against bacteria. But in case of the vocal, we don't like scarring, but we want regeneration of the vocal. Wound healing is divided into three phases: inflammatory phase for 3 days, proliferation for 1 month, and remodeling in 1 year. It's a long process, and there are many factors that affect the vocal healing, regeneration, or scarring, including cells, extracellular matrix, cytokines, and growth factors. Actually, cells produce extracellular matrix or growth factors, and reactive oxygen species, ROS, is fundamentally important because it affects the cells and then cell functions. Oxidative stress is caused by ROS or free radical. Tissue damage by ROS leads to aging, cancer, many diseases, and oxidative stress accumulates with age. That's a problem. We have antioxidant system in our body against ROS. For example, SOD is a superoxide dismutase. But we need to take vitamin E or C or other antioxidants from outside of the body to block other ROS. First of all, we examine the role of ROS during vocal wound healing using rat model. And rat vocal is very thin and we cut to make the injury. Histology shows this is a normal and appropriate of the rat vocal. They run through the tree. There are lots of inflammatory cells. And then after day 5, revitalization is completed and scarring effect proceeds with the times and then finalized at day 56, 2 months. This is very bad scar tissues. We found that ROS appears merely in day 1 through day 3. And after this, there are few or no ROS anymore. So we need to check ROS during the inflammatory phase. We also found inflammatory cells produce ROS during this period. This is granulocytes and macrophages. They produce a lot of ROS. Now, astaxanthin is a strong antioxidant carotenoid, which is included in the red part of the red tissues. We use the same rat injury model of the buckthroat, and we applied oral astaxanthin before and after the injury for 1 week, and then check what happens on PCR or histology. We found very few ROS on the day 1 when treated by astaxanthin as compared to the sham. And the histology at 2 months shows Annulic acid was predominantly reduced in the sham group, but astaxanthin group shows some improvement of the annulic acid contents inside propria, and there was significant difference between sham and astaxanthin. And then we performed a clinical trial using 10 healthy young males by vocal load. The vocal load was applied by a loud ring for 1 hour, and then the voice became hoarse after the task, but 30 minutes later, the voice recovers. So we first do vocal load and then check the voice before and after the vocal load, and then apply astaxanthin to the same subject, and then do the same things. This is 28-year-old male. Per-task, there's a normal voice, and then immediately after the vocal task, the hoarseness occurs, indicated by the red, but 30 minutes later, all things are restored. When we apply astaxanthin, there is no hoarseness, even immediately after the vocal load task. Pitch perturbation or amplitude perturbation shows significant increase just after the vocal load without astaxanthin. But if we apply astaxanthin, there is no such changes. So antioxidant can protect the vocal against the vocal abuse or vocal load task. Now, 20X may be the strongest antioxidant developed by Professor Irafusa in Gifu University in Japan. It consists of 8 elements, vitamin C, B2, coenzyme Q10, or others. We did projects maintenance of singing voice using 26 opera singers. They are professional healthy singers, Japanese, Bulgarian. My age was 51 years old. Somehow, Japanese singers showed significantly younger than Bulgarian singers in the study. We applied 20X for 1 month and then check SVHA 10, Singing Voice Handicap Index 10, before and after the application of 20X. The results show significantly reduction of SDH10 after the 20X application. Japanese and Bulgarian were the same. Looking at the SDH baseline, Japanese singers showed significantly higher baseline as compared to Bulgarian, but the improvement of SDHI-10 by 20X shows no significant difference between each groups. So baseline doesn't matter for the improvement of the voice by 20X application. This shows the relationship between age and SDH10. There was no correlation between them. But when we look at the degree of improvement, young people shows higher improvement as compared to the elderly. Symptoms include effort of singing, vocal fatigue during singing, maintaining singing voice. So antioxidant works well for maintaining the singing voice. So the result shows 20X indicates significant improvement of SDH10 in opera singers, and younger singers may be improved better than older singers. Antioxidant is effective to improve vocal fatigue, maintaining singing. So the recommendation is take antioxidants in the young age. Now, this is age-related dysphonia which occurs around the age of 50, and dysphonia occurs mainly due to vocal atrophy. Histological change of vocal in rats shows reduction of the HA with age and the accumulation of bad collagen bundles with age. This is caused by reduced turnover of the collagen. Bad collagen bundles accumulate with time. Vocal fold muscle is also atrophied and gland is atrophied. This is another problem. We also confirmed that there were more and more ROS in the aged vocal fold using rat models. Age-related negative effects includes a lot of things in terms of cells, extracellular matrix, growth factors. Many things are decreased with age, that's the point. But fundamentally, ROS affects the cells and cell factions. So, we recommend 4 points for maintenance of vocal fold with age. Vocal hygiene, control of acid reflux, because acid reflux increases with age. And also we need to control of airway allergic inflammation. Hydration is important. Drink water more than 1.5 liters per day. And voice training or voice therapy should be effective, helpful for maintaining the vocal closer and antioxidant. In this study, we applied antioxidant astaxanthin in this case when the mouse was young, and then antioxidant was applied for 1 year, and then rats became old, and we checked what happens on the vocal. This is old rat vocal and the propria where the plenty of ROS. But when we apply antioxidant, the ROS was reduced a lot. Uric acid was reduced with age, but antioxidant prevents the reduction of uric acid. So, antioxidant is effective for maintaining singing voice in terms of anti-aging effects or maintenance or protection of voice against vocal abuse or during word hearing. With just a published, this is online access application about the effects of oxidative stress on the human voice. Thank you very much for your attention.
Thank you very much, Shigeru. As we know, the trend nowadays is to have a better condition of the human voice, mainly artistic voice, in the elderly persons. And of course, there are many metabolic changes also in the cell. So it's very interesting. I would like to say hello to Professor Wolfram Seidner. Hello, wie geht's? And also, I would like to say hello to Cecilia Bravo, to Jorge Treviño, to Alfred Schaffer, to Juan Lara, and of course, a great welcome to Professor Yoshiro Sugiyama. Thank you very much. So now I shall read very quickly. I am medical doctor in phoniatrics and audiology and also phonosurgeon. I am director of Centro de Foniatría y Audiología in Mexico City. And I am honored to be the president elected since 2018 until next year from President Collegium Medicorum Theatri. I had the opportunity to be in the university in Vienna 2 years, making doctorate studies in artistic voice phoniatrics and aphasiology. And also I was honored by an invitation from Professor Jürgen Wendler in a fellowship in University or Alexander von Humboldt in Hospital Charité, also with Professor Wolfram Seidner. At the moment, I am coordinator of World Voice Day Mexico since 2000, and from the Union of European Phoniatricians, I am national coordinator and also representative of North and Central America, and I belong to several committees, voice, hearing, and education. I am a special interest in development of rehabilitation techniques for voice professional users. And also I made a lot of research in internationally in the air pollution, environment, respiratory and food allergies effects on the voice. I also made some special voice training for persons with COVID-19. Some publications also in respiratory and food allergies, environmental pollution, and indirect surgeries for singers. And thank you. I wait for the next video. Thank you.
I am very pleased to talk to you in this webinar from Collegium Medicorum Theatri about food and treatment for reflux in artistic voice. This is in memoriam of our dear honorary member, friend, and mentor, Professor Jürgen Wendler. Food is very important because it gives us many of our main functions. There are several foods all over the world, and the food gives us nutrition. In order to get energy, the nutrition needs to be not only quantitative, balanced, but also qualitative. Antoine Lavoisier is known as the father of nutrition. He discovered metabolism in 1770 and the conversion of food and oxygen into heat and water in the body in order to produce energy. The nutrition gives us health and growth, energy production, tissue repair, and reproduction. It helps us to the growth, maintenance, and activities through the intake of macronutrients, micronutrients, water, and fiber. There are many countries that have all the guides about healthy eating. Australia, China, United Kingdom, United States, Mexico, all over the world, they are very concerned about our nutrition. The function of the digestion is very important because we are beginning with the mouth, with mastication, swallowing, stomach, mainly the acids, small intestine with pancreas and bile help, large intestine, and of course, the mastication needs the saliva to begin the breakdown of carbohydrates, swallowing through esophagus and larynx, and of course, we need to form chyme with the gastric juices. The enzymes in small intestine through pancreas and bile break down proteins, fats, and carbohydrates. The large intestine remains dehydrated and turn into feces. The digestion lasts between 2 and 5 days on average, varies significantly between individuals, and it depends on the time of food consumed. Food takes 6 to 8 hours to pass through the stomach and small intestine, while it can take up to 36 hours to pass through the colon. Fruits and vegetables give us sources of vitamins, minerals, and fiber. Whole grains give us energy. Proteins like meats, eggs, legumes, and dairy products are sources of protein and other nutrients. Healthy fats like olive oil, avocado oil, nuts, and seeds are also advisable. When we have symptoms in our larynx and complaints in our voice, we need to perform compulsory stroboscopical endoscopy with 70 and 90 degrees, sometimes also with flexible endoscope. As we notice, there are several tiny details in this endoscopy. The digestive pathology can be dyspepsia, esophagitis, gastritis, gastroparesis, of course, GERD, laryngopharyngeal reflux, and we can have hiatal hernia, colitis, bile reflux, but also food allergy. There are also disorders through the intolerance to the different food. Temporary or sudden symptoms after food intake due to the intolerance to certain ingredients of the food can give us irritation, secretions, inflammation, and dryness of the larynx. There is also another intolerance that it is not mediated by immune response and it is not toxic, like we have with milk products, wheat, onion, coffee, grain, spices, freeze, and also the gluten intolerance. Reflux means gastric content, liquid or gas, coming from the stomach to the larynx. The larynx, as you see in these two endoscopies, can have hyperemia in arytenoids, in ventricular folds, of course in vocal folds, in laryngeal mucosa, and the function can have problems in the posterior glottal closure. We can have also interarytenoid edema or granulomatosis, edema and hyperemia in arytenoesophageal region. There are predisposing factors like overweight, smoking, alcoholism, some medicines without protection, and the incompetence of the esophageal inferior sphincter. There can be also hiatal hernia and other problems, and physiological pregnancy leads also with reflux. The eating habits and the dysbiosis is very important. Medicines can provoke reflux. There are many of them. The mainly are antibiotics, bisphosphonates, iron supplements, some kind of anti-inflammatory drugs, vitamin C, among the most frequent. The reflux facilitators of opening the inferior esophageal sphincter can be tomato, garlic, onion, ginger, carbs, and we need to avoid them in dinner, not pizza. Reflux symptoms, like you have here in the GERD, you have pyrosis, chest pain, regurgitation, abdominal distension. And in reflux laryngitis, that means extra esophageal symptoms, can be cough, dysphonia, clearing throat, obstruction sensation like globus, worsening of respiratory symptoms, laryngospasms, and it is interesting to know that the laryngopharyngeal reflux, 60% of the patients have normal ambulatory reflux monitoring studies. There are some considerations. That's why we need to make a differentiation between GERD and laryngopharyngeal symptoms. Laryngopharyngeal symptoms is in larynx, pharynx, sometimes nose, and eustachian too. Irritants like chile or species, milk products, coffee, chocolate, black tea, acids, beverage, chamomile, mint, and alcoholic beverage. There are some laryngeal pathologies like you see here. The food allergy is an immunological response mediated by immunoglobulin E and can give bowel inflammation and also gastric irritation. And it can be a late response 48 hours. The symptoms of these food allergies can be dysphonia, lack of brilliance, clearing throat, cough, obstruction sensation, difficulty for high tones, phonostastia, and no digestive symptoms or complaints. The examinations for diagnosis are important: laryngeal stroboscopy, nose endoscopy with tomography, breathing, blood, or feces test for Helicobacter pylori, esophageal gastric radiological series, gastric endoscopy, esophageal manometry, pH meter, and in allergies, RAS test in blood, respiratory, and food allergens. In one of our groups of 1,024 phoniatrical patients, we found that the singers, female and male, are the most frequent complaining about food allergies. Here we have females, milk, beef, egg, apple, and in males, milk, beef, egg, and apple. In some other research, 150 singers and actors who complain about dysodias with changes in speaking voice quality, we perform endoscopy, stroboscopy, and nose and ears endoscopy with acoustical analysis, but also through the history, Helicobacter pylori examination. The vocal complaints in this group were mainly high-pitch difficulty, pitch flexibility, mesa di voce difficulty, phonostastia, and then the pianissimi were not very easy to produce. The gut microbiome can give us colitis and slow intestinal movements. We also can have sleeping pathology through these problems, and the allergological treatment needs to have a vaccine 1 to 2 years for making a desensitization, and the application is sublingual or subcutaneous. And it is advisable to avoid as much as possible industrial products or frozen food is all the time better than the refrigerator. And it's important to have a rotatory diet. So as you see, there are different treatments or way of looking at this laryngopharyngeal reflux: hygiene, medicine, surgery, and rehabilitations. Not more than 6 hours between every meal, no big fatty dinner, not lying before 3 hours after dinner, erase the headboard of the mattress, lifestyle changes, food intake habits, avoidance or correction of predisposing factors, sleep on your left side to reduce reflux, and no smoking. In the treatment, we have different medicines: antacids, reduce acid production like receptor blockers, proton pump inhibitors, prokinetics, potassium competitive acid blockers, and also we can use sometimes antidepressants and good physiologist medicines. The treatment in larynx needs a good hydration, gargle for the pharynx with sodium bicarbonate, anti-inflammatory enzymes, mucolytis, and sometimes laryngeal surgery. As you see here, we perform indirect endoscopical surgery in this patient in order to have the function of the voice complete situation. So we can decide to make the surgery as planned, and having the function a very good thing for a better prognosis. And in the stomach surgery, we can have fundoplication, or we can have these devices, the links, or the incisionless transoral fundoplication. There are many psychological factors, as we know, that interact with biological and behavioral mechanisms, and they can be very negative for our prognosis. We need also to make an artistic voice rehabilitation to improve the functions, as you see here, of the vocal folds and the voice. So as conclusions, diet has to be rich in fruits, vegetables, legumes, whole grains, lean proteins, and healthy fats. And it needs to be limited in added sugars, sodium, saturated fat, and ultra-processed foods. In conclusions, also is very important to have a balance between physical activity and food intake. With a good hydration, try to cook as much as possible homemade recipes, and of course have an emotional harmony. The laryngopharyngeal reflux has variety of treatments. GERD needs to be completely diagnosed. If a vocal artist has laryngeal signs and voice symptoms due to reflux, it is compulsory to have all the correct examinations. To take home, food intake in each person is individual. It is necessary to have a balanced diet. Artists need to know the reactions to food. Many times, a food allergy test is necessary. Reflux treatment has many phases, and the larynx is sensitive to this situation. Digestive system has a deep influence in the respiratory airway. International artists must have medicines for digestive disorders when they are in tournée. Thank you very much. Many greetings from Mexico.
I shall read the short curriculum from our dear friend, the COMET member, Deborah Kiegiadaski. She is ENT, phoniatrician and phonosurgeon. She is born and lives at the moment also in Heraklion, Crete in Greece. She is the vice president of the Hellenic Association of Phoniatrists and Swallowing Disorders, also member of the Hellenic Association of Allergy and Sleep Disorders. Since 2014 until now, she is member of the Union of European Phoniatricians, the Voice Committee, Swallowing Committee, and Branding Group, member of the British Voice Association. She has a diploma in classical singing and also a diploma in the theory of music. She has participated as professional singer in various concerts in Greece and abroad. She has numerous publications in international journals and presentations in international and national conferences. Let's enjoy her video. Thank you.
Good evening, ladies and gentlemen, friends and colleagues in COMET family. I'm very glad to be among you tonight. I'm Dr. Deborah Kiegiadaski from Greece, and we will talk about physical workouts for performance. We all know that voice is produced inside our body in finely constructed organs. We can imagine our body functioning as a well-tuned factory, and our voice, in order to be produced, needs air, oscillators, and resonators. Every part of our body, along with our vocal mechanism, is connected to the brain, but also every part is wired closely and distantly to other parts of our body. And talking about our vocal mechanisms connecting to muscles, joints, bones, nerves, and membranes. And we can conclude that in order to have a healthy voice, we have to have harmony and balance in our bodies. Voice professionals are voice athletes. We trained vocally in order to control and evolve voice production, but also we need physical training to regulate stress and emotions, to keep body healthy, strong, and empowered, and also to keep a body toned and attractive. Although in the past being big was connected to a big voice, today productions in opera become more and more demanding with challenging physical tasks for singers. Operatic roles demand energy and power, and often vigorous singing and strenuous physical acting necessitate performers who are fit and energetic. The question about musical theater, where performers combine acting, dancing, and singing at a professional level, but so in pop and R&B artists that they give shows where they sing during complex and demanding choreographies, often on high heels or tight costumes. But also rock singers give powerful performances, demanding energy and passion to keep the high spirit of their audiences. Is physical exercise good for our voice? The way we work out builds strength and stamina. We condition our body to support and positively impact our voice, but can also be harmful for our voice. And that depends on how we perform our exercises or what we choose for training. There are 3 groups of exercises that they're usually used or recommended to performers and professional voice users. These are aerobic exercises, such as walking, jogging, swimming, aerobic movement classes that develop heart length, strength, and endurance. The muscular conditioning exercises, such as strength training, weight training, calisthenics, that are non-aerobic exercises for muscle strength and endurance. And the neuromuscular coordination exercises, which include yoga, Pilates, Alexander Technique, Feldenkrais, Tai Chi, that develop body awareness and the correct relationship of strength and relaxation. We start with aerobic exercise, where most fitness experts agree that is the most important form of exercise for maximizing health. This is not completely true, but it's very important. They have a lot of advantages because aerobic fitness can be easy to manage. For example, walking or jogging is simple and requires no special equipment. We just need to find an enjoyable exercise to perform continuously for 20 or 60 minutes, for example, 3 to 5 times per week. But we have to take into account that we need to exercise at 60 to 90% of maximum heart rate. To estimate our maximum heart rate, we subtract our age from 220. What are the disadvantages? Are there any disadvantages in this? One of the most common problems in developing an exercise program is overtraining. Overtraining can involve pushing our heart rate beyond the training zone. It can also mean exercising too frequently. Overtraining increases risk of injury or illness and increases the likelihood that we exhaust ourselves instead of increasing our available energy. Also, in some forms of aerobic exercise like dance, like ballet dancing, there are specific hazards. For example, about ballet, the need to have constantly a very upright and exaggerated upright position of our thorax tend to stiffen our intercostal muscles and our diaphragm. What about muscular conditioning exercises? This is what usually we do in gyms, in personal trainings, and they involve sit-ups, push-ups, abdominal exercises, TRX, and of course weight training. In this group of exercises, we see the most of controversy regarding if they're ideal or not for a performer, and we'll speak about. One of the most controversial forms of training for singers is weightlifting. Usually we encourage patients to follow it, especially with already established muscle tension, voice difficulties. For sure, heavy lifting is not appropriate for our performers, but what about weight training, for example, with dumbbells or kettlebells, things simple we do in gym training? Men should keep their weight training to a balanced workout that creates muscle tone, but not mass in the neck and shoulders. Especially heavy weightlifting emphasizes in upper trapezius and generally tightens and shortens the back of the neck and the levator scapulae. Male weightlifters develop rounded backs, necks that slope forward, tense shoulders, inflexible abs, and rigid abs, with the result a limited range, decreased lung capacity, and decreased resonance that affects negatively the voice. Frequent mistakes in weightlifting is that athletes usually put strain in jaw, tongue, and larynx. How? By working on a closed jaw, clenching their teeth, or stretching anterior neck muscles on the TMJ, the temporomandibular joint. They tend to push back their tongue into their throat so they can increase the negative pressure, closing more effectively the airway. And we usually see this grunting and the pushing together the vocal folds, larynx, and pharyngeal muscles, so they put extra tension in the voice box. So what are some general rules for a healthy weightlifting? It is to have a proper breathing technique, to use a full range of motion, to proper position our head and shoulders, and follow slow and smooth motions in lifting and lowering. We should emphasize the number of repetitions, not the amount of weight lifted. The general rule is to work at the 85% of our strength, and also you can have a look at it online to work in a -3 rating of perceived exertion that is ideal for singers. How can we breathe during weightlifting? More particular, we see here in this picture is an endoscopy of a man that performing the Valsalva maneuver. Valsalva maneuver is what we do when we lift weight, when we sit in the toilet. Is where the vocal folds that we see here clump together to hold back the air, acting as a valve. So the pressure in torso is increased, and this is used in weightlifters. What we can do, we can breathe out while we lift the weight. So we keep the Valsalva maneuver at bay. So we avoid injuries and increasing the muscle tension around our larynx. Also, what we can do in order to avoid this back position of the tongue is to try say an NG, put our tongue in an NG position against the roof of the mouth as though saying NG. Also, in order to avoid our jaw and the temporomandibular joint injuries, we should mind our jaw position and keep it slightly open, relaxed. We can focus on the proper form of handling our jaw and neck. We can wear a mouth guard if we have the tendency to bite our teeth. We also can warm up and stretch the neck and jaw muscles before or after training, so we can reduce tension. Every little complaint we have around our temporomandibular joint, we should of course consult our doctor, ENT, or the dentist. What about neuromuscular coordination exercises? They're very favorable nowadays, and these include the Alexander techniques, the Feldenkrais methods, the Pilates mat or reformer bed, and Tai Chi. These exercises help singer to overcome tension through stretching and opening thorax and joints. They increase body awareness and breathing coordination, developing strength and tone of the body. They increase flexibility and balance and build a good posture, and also help with stress regulation, mainly through breathing and concentration procedures. So, does training help me think better? Did we answer this question? Physical exercise is not a substitute for a technique or vocal practice. However, it is very substantial because it prepares the body to support the vocal mechanism according to our professional needs, helps with endurance and body awareness, along with vocal health and nutrition, and also healthy habits in everyday life contribute to general health, including our mental health, and of course help us to have a healthy voice. How to choose what is appropriate for us? We are our instruments, you are the instrument. So whatever field improving the instrument helps the voice and has to be chosen accordingly to our needs and personality. It's suggested to train in multiple ways. This is a general suggestion. I mean, to combine exercises from all the three groups that we referred to. And these will have to have different type of stimulus needed to produce size, strength, power, and speed we need. And very important, choose exercise that makes you happy and satisfied. If these problems due to increased tension have already occurred, you also reconsider the way we train, because we might do some mistake in this field. How can I exercise safely? In any exercise program, avoid exercises that leads to shallow breathing or neck or shoulder tension that is transferred to our singing. We'll always train with a professional. After vigorous exercise, give ourselves sufficient time to recover before singing, and avoid, of course, strenuous exercise on the day of the performance. Is the reference I used online. And I finished with this extraordinary performance. Thank you very much for your attention, and I look forward to see you again in our next meetings. Bye.
Much, dear Deborah. And as we have seen, dear friends, there are many very interesting topics that come together. So now I shall read a short curriculum from our dear COMET member, Orietta Calzinoni from Italy. She was born in Milan, where she lives and works. She is ENT and phoniatrician. Since 1987, she works with Teatro alla Scala. From 2009, in charge as ENT and phoniatrician in theaters, health service, and health surveillance of choir artists and orchestra professors. She is an expert member and treasurer in Italian Committee for the Safeguard of Practice of Italian Opera Singing, recognized in UNESCO as Intangible Cultural Heritage list in 2023. This is really a great thing. She is also senior member of COMET and member of the Union of European Phoniatricians and Voice Committee and other Italian and international associations. She has many main projects, among them Italian Labor Ministry Commission, national guidelines about noise protection in entertainment sector since 2012. She's in Scala Milan in Polytechnic. She also has been giving research in singers and wind players' respiratory patterns. They are the results in evaluation. It's very interesting. In 2020, she was at the Milan of Conservatory giving lectures about science and art in voice. And this was also a publication in 2021. In Scala Milan University, she has been researching and teaching about hearing assessment and preservation in professional lyric orchestra and choir artists. And this paper from this very interesting topic is in print in 2023. So let's hear and enjoy the video of our dear Jorrieta. Thank you.
Dear Eugenia, dear all, how are you? Well, I try to steal you some 5 minutes to present you a nice thing, what happens to physician following a tournée. So it's not like it's their doctor on board, but you must not panic, and instead of carry a towel, carry nurse. And how many people is a tournée? Yeah, well, for Scala it depends if we are putting up a concert, an opera or so, but anyway, you must think of the orchestra, the choir, people from the administration and logistic, and people to move mechanical and bring instruments and carry on all things and stuffs that are needed for the tournée. What to plan before and during all days out? Well, as I told you, it's different if we are planning to have a tournée with an opera, or like in Moscow and Bolshoi in 2016, or in Savonlinna in 2019, or a concert with orchestra and choir like we did in 2023 and now in last September. Make people bring their own treatments if possible, of course, but they will often forget, so take yours anyway. We always travel with a metal box, some 1 meter for 70 centimeters, which travels with the instruments boxes, and a big suitcase, and also something with us, with everything you must need, but also with things you may find in every chemist around. And this is from the Zollverein carbon mine in Hessen. But where will you work? Well, I show you from the best till the weirdest. This were Bolshoi. In Bolshoi, it is a theater. It's like not like it being in Scala, but in many theaters, huge theaters, many theaters, you have infirmary with really a huge kind of instruments and many things you may use to feel like yourself. They had a K instrument and many other things, and of course a very pretty place to be. This, on the opposite, is a part of a Savonlinna castle. Savonlinna is a castle on a little island in Finland, and it is made in stones. And of course, you must think of places. These beds are not our infirmary. These beds were on stage because we were performing Masnadieri by Verdi, and you had a lot of stairs going up and down to reach different places. The other one, the right down, is instead a place to put infirmary in an outside stage, not far from Vienna. This is still Savonlinna, and that was my nurse that time. She was my nurse in that time. We were happy about this room, but soon after, the violinist stole this little room for the cages of her instruments. So we were with an artist right down the stage. The stage was upon us, and we were downstage. And I also had some optic fiber with me. Not always I carry optic fiber, but if I have soloist, I will try. But as you see, my room in hotel became some sort of a private practice, very private. And as you see, this is Savonlinna, a huge, impressive vision, but under that black surfaces, we were down under in there. And this, you must think that this was the exit for artists, or you have to wait until all the audience went out. But in Finnish colleagues were accustomed to walk in this little path at the edge between the stones of the castle and the lake. What to prevent? Of course, we must prepare people to avoid barotrauma with ears or sinus, to avoid infections, airways infection, but also dental infection, bowel, urinary, may be difficult to be bared by artists during a tournée, and also prolonged mobility disease, but the hidden risk is dehydration. And in the same time, you must remember that it is not so easy to drink water in tournée because airport check-in stops water, and few airports provide free water points. Buses may not provide the restroom, so avoiding drinking permits to reach the next stop with less urgency. And airport, hotels, buses, and theaters backstages offer recirculated air and low humidity air. And also in restaurant menus, we rarely choose, or they offer soups or plates rich with water, with vegetables, fruit rich in water. And also, on the opposite, we drink some coffee, we drink some alcohol, and much more than water. And there are very few theaters offering free drinking water dispenser. And some people may use diuretics or other treatments which may favor dehydration. So if not in one day, but during a tournée, maybe of the week or more than a week, dehydration may happen. And what to treat? Of course, we have to treat suddenly barotrauma, ear or sinus. We have to cope with orthopedic trauma, usually a little orthopedic trauma, but sometimes happen the worst thing. Infections, of course, but also anxiety, sleep disease, even if we do not change that much on fuse, but sleep disease may be simply because you are out of your bed. Vertigo, mostly parasympathetic positional vertigo. Allergy because you are in unusual places, you eat unusual food, maybe in different seasons, and so you find back pollens you think are not of the season, the prolonged immobility disease, and also the dehydration. This is one of the trauma I told you sometimes they are not pretty at all. And this happened with a simple, simply falling with a bicycle. What the dehydration, which are the symptoms that may make us suspect of dehydration? First of all, dry mouth, lips and tongue, not always a reflux. Dark yellow, strong, smelly urine, but you must ask for it because people won't tell that to you. It's ugly confusion, sense of fainting. It's not lowering of pressure. It's not because of cold, the temperature on stage or light on stage, but maybe because of the dehydration. People feel dizzy, people feel lightheaded, people feel tired, heart rate may become rapid, sunken eyes, but with people that sometimes have some aesthetic treatment, is not easy to sunken silicone. And also voice dynamics are hampered by dryness. Again, they think of reflux, I do not think of water. And many get accustomed to that. So the last thing they will tell you is that they are thirsty, mostly with age, as we know with our elder friends. And all these make hard to be on stage. So a take-home message: be present 24 hours, 7 days on 7 during the tournée, but enjoy yourself as well. And you are abroad, sometimes you are in places you have never been, so try to enjoy even a few minutes. Give as much empathic listening as possible, and as little treatments as possible, because you do not know all people, you have not the time to know all the treatment they use, even if you are acquainted with them. And beware of possible iteration or side effects, and most of all, what's next in your schedule, because it's not a matter if I make you rest today, but it's a matter of next week, next month, you will be able to do this or that are already in your schedule, even when we are back home. Please transmit your reports with PDF, because I'm pretty upset to get what's up, my physician wrote this, and it's on a sheet written somehow, and we physicians always write in a very bad way, at least in 2 languages, so maybe understood where you are, in the country you are, or at least in English as second language, and take all you might need with you, because every country has different ways to get medicaments. So it's not always so easy as you are at home. And even if it may be strange to you, it's easier to substitute a soloist or a conductor than some parts in orchestra or choir. And so take care of everyone. Work side by side with logistic and administrative guys to reduce complications. And there will always be a better physician in tour, a better physician in parents and relatives of your guys, but the target is always level play. Thank you.
Wonderful. Yeah, thank you, dear Orietta. So, dear friends, as you see, the topics that we have today are very interesting. Of course, we are making an addition without all the technical problems, and I apologize for that. But first of all, I need to congratulate you for the wonderful presentations you sent to us, to COMET. You belong, of course, to the COMET family, and congratulations also to the assistants. And I may say you that in Article 2 of Collegium Medicorum Theatri, the purpose of our organization is not only to encourage the scientific investigation of the physiology and pathology of the voice of singers and actors, but very important, and that's why every year COMET gives a webinar open to the public to exchange knowledge and ideas among all the members, but also in participation with the audience in the form of these webinars online, even though we have technical problems. So we enjoy very much this presentation. So as you know, the purpose of COMET is also to facilitate the referral of a singer or actor to a well-qualified specialist in another city where the artist is scheduled to perform. And as Orietta said already, all the details that the physicians need to have when they are in a tournée, following a tournée. And of course, for the artist, is very important the support of a medical doctor that understands everything and that is a specialist in singing voice or acting voice. And of course, Comet also develop educational activities related to the vocal problems of singers and actors. As we have these topics, we enjoy that very much, and I hope our assistants also. Of course, our task in Comet is to disseminate scientific and clinical knowledge about artistic voice. And that is very important that I invite everybody to go to our members' publications in our YouTube, all the presentations that we have. As you know, today is the 24th presentation online. It's very easy to say. So we shall have in 15th of November, our 25. So we need a cake to celebrate 25 sessions. Don't you think so? So I invite everybody to go to the members' work. As we know, the special contributions from our dear Professor Dr. Jürgen Wendler in many of the things that you know, singing and science presentation, where Harm Schutte also made a great effort that we could publish that, but also the history of the Union of European Phoniatricians and the glottoplasty interview. And of course, we have many Voice Foundations sessions and virtual meetings with permission of the speakers. And the UEP, the Union of European Phoniatricians, we have Comet round tables, and we shall have also that from this year in our YouTube when the organizers from Prague give us the recordings. And of course, very important, as you see here, here's Professor Roland Steiner, Erki Wilkman, and Johan Sundberg, and of course, many of our dear friends from Comet family. And this is important that you remember our next date. Yes, Karina, the next one, please. That we have the 25 online academic sessions. So it's open to you for your proposals. Don't forget, this date is important. It's the last day of our online sessions from this year. And of course, we are going to have General Assembly 29th of November. This is only for our associates and fellow members. And our toast is 13th of December. And everything at 11 o'clock Mexico City time, because on Saturday is the best. And don't forget, we are waiting for your proposals. If some of the Comet members want to be hosting the next annual conference for 2026, as you know, Madrid could not make that. So I invite you. As you know, Comet family is wonderful members. Dick Stasny, me, and some others know exactly what is happening when we host some of the annual conference, like Dick and Austin King made in Houston and Santa Fe and Aspen, and I made that in Mexico. So we are open to the proposals. Don't forget to subscribe in YouTube, and also this is important if you can look at the different conferences, because as you know, even though we are not a YouTube channel with monetary interest, but we are academical YouTube channel, so it's important for us. So, and now we shall open our videos, please. Karina, everybody to take a picture, and after this, we shall discuss and have some questions for the presenters and of course from the audience. So, yes, now the picture, the official picture of, you can stop the presentation, Karina, and then everybody is over there, I think. If not, well, yes? Can you stop the presentation? No? Okay, so I shall begin with the discussion, and we leave our picture for later. It is very interesting, Soledad, with all your experience as a PhD speech therapist and also voice coach and teacher, and of course, singers. What do you think in your presentation? You told us about the different patterns of in different countries, what's happening with all the breathing, supported, not supported. But what do you think? Joining the presentation of Deborah, what do you think that sometimes in musical theater and also in the opera performances, we have different positions of the singers. So what's happening with the breathing? Can you comment something? Oh, here we are. Oh, dear Ron, great to see you. And Rosa Maria, and okay, I say hello to everybody already. So great to see you. So please, Soledad, if you can comment something about the topic that Deborah presented today with the breathing pattern.
About differences in breathing behavior. I think most of the differences are related to gender origin sometimes. Women tend to feel the pelvic floor more important than the hypogastric region more than the epigastrium in the practice. And I think there is not a common sense about whether if it's better a belly out technique or a belly in technique. I prefer myself a co-activated diaphragm where both abdominal and diaphragm are contracted together. I think that it's important, as Deborah told us about the exercise, tonic, you said muscle, when it's contracted muscle, especially when we are aged, no? Postmenopausic, and well, I don't know if I am clear. I'm sorry.
Great to hear that. And I would ask also another of our singers, Liza, if you have some comments about these two situations together. So the different positions that a singer can have on stage due to the performance. So what would you think about breathing patterns or of the position, for example, when you have the head down? Liza?
I wish I had a good answer for that one. I haven't worked with gymnasts, and I find it quite difficult to sing in the laying down position. So I don't know. I don't actually know of strategies for these abnormal situations, upside down, twisting in the air. I would always try my basic approach, which seems to work for everyone. And in my workshops, I always say that there are many support methods that work. And I call it support when you are pressurizing the outgoing air, and breathing. I use the word breathing for the intake when you're not singing. I just find it that approach to separate the term breathing from support to be useful in teaching, because they're different tasks. So the method that I teach seems to work for all different styles as well. There are certain methods of support that that may work for rock singing, but not for classical, or vice versa. So, and I also think it's important to tell, as a teacher, to tell students exactly what to do and what it should feel like in the larynx and the vocal cords when it's the right amount, because there are people out there who are very enthusiastic, and many artists are, I call them 120 percenters. Those are people, if you give them an instruction, they'll overdo it and have a different set of problems. So laryngeal comfort is the key, and finding the support method that is clear, reliable, consistent, for normal singing postures, I think it really enhances the confidence of singers. So they're not guessing at how to support, but they actually have a methodology that they've made second nature. But sorry, I don't have a quick answer. Maybe if I'm ever if I'm ever in a gym, I'll be annoying and I'll hang upside down and try to sing and see if I have to come up with something new that works.
Thank you, Laika. And I was wondering, Alan, if you as singer, if you have some experience in some of the positions of the different titles that you sang. Do you have some comment here, Alan?
Of course, breathing is very, very important. But I think that the most essential is to understand that breathing is a dynamic process. It's not something static that I use only those and those muscles. And moreover, when we breathe in and our lungs are full, then the elasticity of tissue is maybe creating even bigger exhaling pressure that is needed for a certain tone. So this means that although singing is on exhaling, I must use muscles which are meant for inhaling. But it changes when the lung is only half full, and when it's empty, then I, of course, need to use much more abdominal pressure, stronger. So the elasticity, I think, is the most important. And as everybody has said, there are different ways how to organize. So whether it's more this diaphragm, abdominal pressure muscles, or rib cage. And big question is when you are singing student and your teacher is from opposite sex. It's true that men and women maybe this most favorite techniques is a bit different depending on your body type and whether you're male or female. But when your teacher is from opposite sex, what is then? Maybe what is the best for your teacher is not the best for you.
Alan, I would love it if you would do a short presentation on that topic about sex differences in your experience and mechanical differences. I think that would be very interesting for us.
Yeah. This is a really interesting topic, and I can do it if you wish, of course.
Yes, please.
Yes, you were suggesting, and I agree with you, to talk with some of the directors in the Cirque du Soleil or whatever. Tell us about that, please. Yes, Orieta.
Who are you asking?
Orieta.
Oh,
Orieta.
sorry. No, Philippe Goudard is a physician, and he works in Montpellier with circus medicine. And Madame Sandison is an acrobat, and she developed a very high method to perform because she suffered a very, very bad accident, almost lost her life, and so had to recover and regain all the ropes. But I think that these people may help our artists to understand that sometimes I talked about Giulia Lazzarini and Giorgio Strehler in The Tempest because he wanted her to fly. I do not know really if you know that beautiful performance. It was astonishing, really a milestone in Italian theater. But the stage was empty, and the director, Strehler, made her fly over and appear and go away. And so he had to work out with her. She's a very now almost 90, I think, but very thin and a little a perfect Ariel, but not to let her perform. So they work out how to hang her and let her have air support and movements, even if she have to act very long parts in Ariel in Shakespeare. Has a lot of things to do, and she was always arriving and moving and going, and she was really the sign, the demonstration of elasticity in voice. But I think that we should let our singers to understand that nowadays more and more it's not only a matter of musical, it's not only a matter of pop concerts, but also in opera singers. Many directors make up some strange things like we saw, and you have to cope with that. It's not only a matter of Desdemona who gets strangled and give up, but you have really to understand that the physical, the vocal artist is not only vocal, but must be an athlete in itself, and also the difference between athletes and let your voice free, which are mostly different things. If you listen to a tennis tournament, you will say, oh, and so it's not really artistic, and in many other sports. So we must let our people to develop resilience and understand not to hamper their voice, because once I met a very young girl who was starting to sing, but they wanted her to sing while I do not know how to say it in English. When you have a turn of your body, and I've never been able to do that, but really doing many of these things while you are singing. And she never tried that. She started to improvise that, and she suffered a very bad condition of vocal folds. But if you may let people understand that you must be confident with your breathing support, with your voice, then maybe that you have two different behavior, one motor behavior and one singing behavior, which are coping together, like your costume. Don't you think, Lisa?
Thank
I
you.
do, and what I have worked with are dancers who are singing, like for musical theater, and so I have a plan B for dancers, because they have to have tighter abdomens in order to be able to spin, and so we move more of the work to the back and the waist to compensate. So yes, I think, and Alan used the word flexibility too. So this idea of there may be a standard way that when you're just standing there singing, and there may be alternate ways that you have to have experience with to protect the vocal fold health. But what those are, now I have a friend who was a singer for Cirque du Soleil. And now she teaches in New York at a school, specializes in musical theater. And I'm going to reach out to her, because she may have some real insight into the special needs of now, I don't know in Cirque du Soleil when she did it. She was the singer and they just stood there. It was still very difficult singing, but she stood there. And then the acrobats did not sing. So maybe she doesn't. But I think maybe in the newer shows, the acrobats are singing. So we really need to find someone who would be could be a guest at some point and share their insight about this very specialized and extremely difficult singing demand.
Yes, thank you, Eliza. And I would like to ask Dick, because Dick has been in charge of so many artists, so many singers and dancers, and well, what do you think about this topic? Because, for example, in Mexico, there was a performance about Nibelungen ring, and they were flying downwards, and there were three sopranos, and I asked them, they were my pages, I asked them, what do you feel and things, and they say, well, I didn't take care so long because it was a very short time that they were singing with the head down, and they didn't complain at all. And I think it's a neuromuscular coordination and education that we already have. But anyway, this is an interesting thing because, as you know, the musical theater and opera is demanding more and more and more different things. What do you think, Vic?
The political left in this country says there's no difference between males and females, and that 6'4" males can swim against 5'2" females, and that's fine. The transsexual situation in this country has just gone crazy. So the people that said there's a difference between males and females in the earlier presentations were, according to the political left in this country, were incorrect. But we had the female lead, the soprano in Parsifal, sang the entire first act lying on her side on the stage. And I don't know how she did it. And that's the sort of thing that flabbergasts me. And if you ask 100 vocal pedagogues, you'll get 100 answers. And I wish there were a way to be precise and scientific in how you teach people to sing. We had a singer that was a vocal pedagogue in Houston that ruined all the singers that went to her, because she said, if this isn't so tense that you could bounce your thumb off of it, then there's something wrong with you. You have to just absolutely tense your entire neck. And Ron Shearer will tell you that that's not an appropriate way to sing. So I wish there were more science in that, and that we could be more precise in how we teach people. I enjoyed the presentation very much. That was a great presentation.
Thank you, Dick. Well, what I personally think is that, of course, it depends on each artist, but we do have a physiologist. We do have also a training for a certain purpose, singing, acting. But of course, if you are going on your daily life, doing exercises, having more tension or having more effort of this area or of other areas, of course, it is affecting the singing. For example, when we are making surgery in indirect way, we are having in the hands the endoscope and the micro instrument. And of course, this is a posture different when I have to give some lectures or things like that. So I think everything can affect the voice. And of course, what I personally think is that each singer, depending on the performance and depending on the production of the presentation, has to work with the doctor and with the vocal coach and with the singing teacher, and then decide what to do.
You're right, Eugenia. And right now at the Texas Voice Center, we've got 4 speech pathologists. One's they're all opera singers. One's a tenor, one's a baritone, one's a bass, and one's a mezzo. And one of the biggest chores they have is to pull the stress out of the vocal folds and let people sing with finesse without so much stress. And when the conductor yells at an opera singer or the director yells at them, this thing will just tighten up. So I think there's a lot to be said for. I send people to yoga to learn to relax. that are get all tense. And I think those kind of exercises make a lot of sense. And I wish that we could come up with some consistent way to teach young singers so that they don't get bad habits early. There's some fabulous vocal pedagogues that I've been exposed to, and then there are a couple really bad ones. And you hate to have a great singer ruined by somebody that can do bad things to their voice. And anyway, I just wish there were more science in this and we could come up with consistent ways to teach people that didn't involve a lot of stress.
But for example, we talked today about topics that we cannot be so precise as we want to. One is, of course, breathing. The other one is exercise. The other one is traveling, and of course, food, and of course, environment. So there are so many factors that can change the way of the artist and the way of the performance. And then, as Orietta says, very important, the administrative and the production, because sometimes they are demanding more and more from the artists, for example, in the cruises also, and in Cirque du Soleil. So I think
if Ron's still on, Eugenia, ask Ron what he feels.
Yes,
ask Ron, sure.
Because you are the scientist now. So, but of course you also
is Ron still on is Ron Shearer still on?
I am.
Yeah, ask Ron.
Tell him what do you think? Because not everything can be so precise. I mean, mathematics are wonderful. Yes, Ron.
Can you hear me okay?
Yes.
Well, my initial thinking about all this is that there's antagonistic muscle action for about everything we do, including singing and standing and walking and all that sort of thing. So if we're in asymmetric postures, or if it's symmetric and we're completely upside down, the gravitational aspects combine with the antagonistic muscle aspects. And certain antagonistic muscle aspects in the larynx probably don't see gravity changes too much. But as soon as you change your body, as all of you would talk about really much better than I, of course, would be blood flow, etc., would be changing quite a bit. So one has to balance the antagonistic muscle action. One has to balance the respiratory recoil that Alan talked about, as well as the antagonistic muscles of inhalatory and exhalatory. So that has to be all balanced. And then all those other aspects wonderfully discussed about strength, endurance, etc. So that's the initial thought, the basic aspects. And if you think subglottal pressure is the main thing, then it's always about the respiratory aspects to produce flow and pressure with laryngeal adduction and posturing. And I don't remember if there was something else that Dick wanted to make a comment on. Dick?
I think you said it well. Was Dr. Hirano, is that Minoru's son?
That is correct. Mm-hmm.
I wish you'd talked about that, because Minoru is one of my favorite humans in the world. And I actually understood his description of the physiology of the larynx better than I did Ingo Tietze's. I read the book 10 times, Ron, and I still couldn't understand it.
Well, that's that
physiology is the basis. And of course, there are many individual patterns that can change. For example, in the singing efforts in rock singers, there are also many issues that are not so healthy, but on the artistic way, they are accepted, and we have the artists, and the artists, they do not have any harm at all, even though they are having this rock singing concert in a very hard situation. And I wanted to go to Shigeru Hirano, to the antioxidants, because I think this is a very important situation. When I was studying my fellowship in allergy, in respiratory and food allergies, we talk a lot about antioxidants because we know in the elderly people, we have more problems with lungs and with larynx. And that's why we began also to make some research, but in the allergy. And now Shigeru Hirano and his group and other colleagues like Tsukiyama professor, that we need to make the votation for him. Well, they are working a lot with rats and with other things. So I do think also about the food situation that we need to emphasize that the artists need to have like a support of the energy, but not only by food, but also by vitamins. For example, vitamin D. For example, in the problem of COVID, we exaggerate vitamin D, and of course there are also side effects. And another thing that is important about antioxidants and about all these metabolic problems with vitamins is vitamin K2, because vitamin K2 is very important for the ladies in menopause, because as we know, without estrogen, the calcium travels more to from the bones, and so vitamin K2 is nowadays very recommended for ladies after 50 years old. And for the singers, it's important because, as we know, and Orietta emphasized that, tourneys, traveling, you have problems, you want to go shopping, or you want to go and to have some tour, and then you have a problem with the bones and things like that. So it is complicated now for us because we have many information now about food, about reflux, about psychological problems, and of course we have the antioxidants. And I would invite you all, and I shall write to everybody, to give the recommendations about vitamins that you use in your country, because it's important. And I remember Orietta had a wonderful research about plants. And in Mexico, we have many plants, but there are some plants that are not so good for voice. It's only more tradition. So there are a lot of information about that. And Ron, I wanted to ask you if you have, with your doctoral students, if you have made some research about elderly voice.
What kind of voice?
Yeah, elderly voice. So
yes, there's a dissertation right now, Katie Fairs, DMA, and she's finishing up now. She's done a really broad survey dealing with the difficulties that women have past the age of 40 that are physical, laryngeal, performance, dealing with directors and productions and all that. And we will be offering, actually, that would be a good talk for Comet, one of the meetings here. But she'll be she'll be finishing up that dissertation, and we'll be presenting that, or she will be anyway, at different meetings, Voice Foundation, and I'm sure Nats and other places. So that'd be a great topic for her to share with the Comet group here.
Okay.
I had a question for Orietta, if I may.
Yes, please.
Hello, Orietta. Quite curious about for touring, what's the best thing to do relative to getting in touch with health professionals near or in the cities that the tour is going to, preparing that sort of thing, so you know what the environment there is like, what the people there expect, how to make that most efficient? What do you do for that preparation?
Well, thank you for this question. It's up to me because when I'm going abroad, I always try to get a look to the nearest hospital, the nearest, for instance, in Paris, I have Ercchi Bianco or so, but if needed, where can I go? And for instance, in those pictures from Bolshoi, we were in the infirmary in theater, but the beautiful corridor with the K instrument and so is really in a little building, a 3-story building, and one store is downstairs, underground. And they have everything inside, or at least they had it in 2016. But I had to present a request in Russian and so, and obtain a permission and go there. And it's possible, but you must cope everywhere with what you need. On the opposite, in Savonlinna, I was much nearer to Leningrad, to St. Petersburg, than to Helsinki. So I have a lot of good colleagues in Finland, but all the SEALs were more near to me than those colleagues. And so you must understand. But many times, mostly if you have a soloist with you, also musician soloist, but also with choir and orchestra, it's very useful to make a net also with their own physicians. So you may know and assess and understand what was there, because sometimes you meet a person for 2 days, 3 days, a week, and you almost do not know anything about that artist. So the better thing is to make them feel that they are not alone, they are not improvising something, but that might be simply constructing a net and exchanging data and understand how to plan, what to do. And as I told, and I suggest once more, the less you do, the better will be, the best will be, because sometimes it's like intervene, I think, in an athlete in Olympics. He has a long story who brought him there, and you can't improvise, oh, I will give you this magical pill and everything will be good. So you must understand what's needed and what's not.
Mm-hmm. That's a good point.
Not
But
so easy.
always trying to make a net.
Yes, you need the stories, but it is very important for the group that it is internet to have a medical story. Each member, of course, we are talking about the ideal, but it is important. For example, I have the idea that when we are in following a group, we need compulsory which allergies they have and which food is irritant. Because, for example, in Mexico, we have 30 or 50 kind of chiles. Wonderful, the taste is wonderful, but not everybody can accept that. So we need to have that. It looks like restaurant. Are you this? Are you that? But I think the doctor has to know that. And mainly because we know that reflux or laryngopharyngeal or GERD or whatever is having a lot of problems for the voice. And this is also the controversy that we as part of the team, medical doctors, vocal coach, vocal singing teachers, they need to know more about that. Not that everybody is medical doctor, but only to know. And mainly the patient, because the patient is obliged to know about his or her throat, larynx, lungs, and of course, stomach.
But that's true, Eugenia, but I can't I can swear you that my grown-up children, mostly tenor, will try every street food everywhere in the world, and they sometimes send me photo. What's this? I will try that. So we have not been yet in Mexico. Might be next year's, but I'm sure that they will prove every chili. So
I have a question. Is it
For
ever?
One moment, Lisa. Apropos doctors, well, as we know, and Dick was emphasized that very much, in COMET, we have the medical doctors or the vocal coach or the vocal scientists like Ron. So we are a special group, and we need to have this list all the time. Yes, Liza.
I have two questions. One is, do you, Orietta, do you amass or put your list together once you know all the cities that are on the tour? So you have a list of referrals prior to the tournée? Prior?
I make my own, or with people I know, or with people that are not so far. Or, for instance, in Moscow, there was an American hospital, and that was my my reference, because I do not speak Russian, so that was an easy way. Even if Russian colleagues in Bolshoi, they were very friendly, and there were some 3 or 4 ENT among all in Bolshoi. But yes, I try to get a list and to understand, or sometimes just to send things, check with other colleagues in there, also to understand how to cope with different normatives to have medicaments or so, because they are different from a country to a country.
Mm-hmm. So you bring your own, like for diarrhea or vomiting.
This time, as soon as we were arriving in Germany, I was looking for a dentist center, because one of the violin had some strange thing, but we were coming back on Saturday night, and they were starting the next tour on Sunday afternoon, and they are now traveling around the world with Myung Chung. And so I couldn't let someone with a dental problem to fly away for somewhere. That's just 5 minutes.
Preparation. My other question was, do doctors ever, such as yourself or Eugenia, do you ever, is it possible to do a presentation during a rehearsal for an opera on healthcare before a tour begins? So, because we assume they know about reflux and sleep and eating and water, but maybe some don't. And I didn't know if it's ever done. I don't know. I have a feeling in musical theater tours, sometimes a doctor will do a presentation as part of before a dress rehearsal, just on maintaining vocal health. But I don't know if it's ever done in opera.
That's a good question. And in Houston,
wonderful.
our we don't have a repertoire theater, so Houston Grand Opera has traveling performers from all over the world, and a great resource for many of those performers used to be Kathy Goldstein, who was Jim Gould's, who founded COMET. It was Jim Gould's nurse. And they would call Kathy from all over the world and say, who do you go to in Cairo? Or who do you see in Milano? Or wherever the city was. And she'd refer them. Margarita Rodriguez, that Eugenia knows real well, my nurse for 35 years, performs the same sort of referrals. She gets calls from Paris and London all the time, and she will refer them to friends of ours, and most of whom we met through either PAMA, the Performing Arts Medical Association, or COMET. And I think it it'd be great to have COMET serve as that resource. So if people want a doctor in Cairo, they would go to the website and see who the people are that are members of the COMET. And so I think that's one way to find a doctor in wherever you happen to South Africa or wherever you happen to be, or Tel Aviv. We've got that covered in COMET. So
that
Yes,
in
Liza,
Scala.
Yes, Liza, one moment. So what I have done is to have different very short conferences to say, for example, why is this important before they are going to other places in Mexico Republic, why it is important to have influenza vaccine, why it is important to have COVID vaccine, and of course, how can they take care of the food. Some artists, please take like a box lunch as you did when you were a child, because sometimes it is 11 o'clock in the evening and there is no possibility to eat something. So they are only eating junk food or something. So I think this is a great idea from Liza and Dick to have in our YouTube channel, and I invite you, if you propose, I can talk about food, that we make a short presentation that is available for everybody, and it is important. And another thing that I did in Mexico, I made a conference for theater producers and for opera producers, that they know that the artist is something special. Is of course a prima donna or a very hidden tenor, but it is important because they are the artists and they are selling through the artists because they are producing shows, no? Yes, Orietta.
Yes, in Scala, indeed, we are, I think, the only, as far as I know, the only Italian theater who has an health system inside the theater. So I can do things as an ENT, and there is also an orthopedic responsible who follows mostly the ballet, while the physiatrist follows mostly the orchestra when they go alone in tournée, as well as in theater. During pandemic, I started to have some sort of spontaneous night webinars about topics with the core mostly. But soon after, as we started again to work, we have nowadays some 300 rise of curtains in a year. So they have rehearsals, many things. And so sometimes they say, I'm too tired to listen to you. But as well, when we perform that surveillance about hearing and voice in orchestra and choir, and so, and we are trying to make them understand. But it's a really great suggestion, and I think I'll propose to the new health responsible, a new colleague, because the former one got retired last year, and try to make something more more constant, more some sort of fil rouge to make people learn more about their profession. Great, as we did in 2016 in Milan with the COMET Congress about prevention in art. It's always the same topic in a sense.
No, I didn't mean to say that we didn't do that in Houston. We have a Houston Opera Studio that are young students, and they've actually we have 4,000 applicants for 4 spots. So they're incredible young people, and we have around 20 of them now in the studio. And we give them a lesson every year on how you keep your voice healthy and what to look for, and all these things about staying healthy on stage, so that when they travel the country. One of the panic phone calls I got one time was from a soprano that was in San Francisco. This is 30 years ago, so it doesn't impact on anybody there now. But she called me and she said, I had a cold and I went to the doctor and he told me I've got nodules. Well, she had little tiny bumps that many sopranos have, and they sing in spite of that. And so after that point, I gave every singer I saw a DVD of their laryngeal strobe and a picture of it to take on the road with them. So when they went to see some strange person that really didn't take care of many opera singers, and they said, "Was it look like this?" Yeah, it looks just like that. But I can sing fine with that. And I just have a cold and need to get over my virus.
Yeah, since years in theater, as soon as we assume someone, we hire someone, they have a full check both in hearing and fibroscopy, not only laryngeal fibroscopy, and in last year also vocal analysis, and so which becomes some sort of starting point for every 2 years check or so. But in my experience, indeed, I'm not as lucky as you, because it's easier to talk with professional in theater than with the youngest in a conservatory or an academy. I feel them yes, interested, but it's not my my problem. I'm Parsifal. I will get my growl, and no problem with me. And their most problem was how I get the turtle in my abdomen, because I must look fit in my Instagram, and so we must regain the Italian school of singing.
Most of our studio students are 24. They're already got a master's degree. And so we don't have to deal with adolescence and the bulletproofness of young adolescents. We deal with people that are more reasonable about their body and don't think they're Hercules.
Yes, say something. Ron?
Yeah, to continue this a little bit and respond to what Lisa was asking. When I was in Denver, the Denver Center for the Performing Arts, there are a number of venues there where traveling groups, usually the top-rated staff and actors and cast would come through Denver. And we would know about their coming, of course. And within about 2 hours after they were gathered, when they first came into Denver, a group of us visited with the cast and talked about Denver in many ways, especially being high and dry, and what to expect in that kind of environment. And we discussed and posted a sheet that had medical aspects of ENT, sinus, neurology, etc., because the dancers and all that sort of thing. So we prepped them as soon as they got there. And just anecdotally, apparently Pavarotti sang in Denver once, and that was it. He didn't like the high and dry, and so he never came back. But we prepped the casts and the touring groups when they came. So we were ready for them, and we did it immediately so that they were ready.
Wonderful. So, my dear friends, I think I really thank you very much for the wonderful work that everybody did as assistant or as a speaker. And as we know, Comet family has to work a little bit more. I'm sorry to tell you, but these are the necessities of our world. And this is a magnificent group. So I invite you to send the proposals, and I shall send you what you also propose about having this special presentation for everybody in a very light language, and also about the vitamins and the antioxidant list. And I thank you very much. I don't know if somebody wants to say something before we leave. Orieta, Liza, Alex. Yes, Ron?
I do. I'd like to say that this was a very meaningful session, as all of them are. And I have taken some notes and some pictures, actually, that I'm teaching voice disorders this semester, and they will be part of that course. So I really thank you for helping me with that.
Yes, anytime, please let us know. Okay, my dear friends, dear Orietta, carissima, Liza, very dear Liza, very dear Ron, very dear Alan, and lieber Wolfram Seimer. Ich danke dir herzlich. Thank you very much from our heart. Bye-bye. See you.
Bye, everybody. See you next
Bye.
time.